Are there, as we get close to closing this out, are there, a couple stories you would share in terms of just some things you've seen out in the industry and you go, man, they're just doing it right. That is, that's going to lead to a really successful implementation.
There's a lot of stories. Let me give you two right now. One is Biden Health. We haven't done a before and after measurement with Biden Health, but they, by their own admission, said, hey, we were in a really bad spot with our EHR, and nobody knew how to use it very well, and we had a lot of frustration around it. They did a big upgrade, but they used the upgrade as an event. And they said they went to all of their hospitals. So they're on the East Coast. They went to all of their hospitals, and their community hospitals. They don't employ almost any of their physicians. And they changed the bylaws of each individual hospital one at a time to say a part of having privileges at this hospital is being an expert on our technology in order to deliver quality care. And then part of changing that bylaws, they set expectations with everyone. And they, of course, they had to have CEO support doing this, right? They set expectations. Hey, we're going to retrain everybody. And then when they did their retraining, they had physicians do the retraining. And they said, we had amazing training because we knew that if we were going to require this and change these bylaws, that now the pressure was on us to do great. So they had great training. We measured them, and their satisfaction was off the charts in terms of what they had done. They had worked with their people incredibly well. They had expected a lot out of their clinicians. And their clinicians, of course, rose to the challenge. These are some of the smartest people in the world. They rose to the challenge, and now they're able to have a baseline to go work on improving clinical outcomes in different areas and do some things. There's one other group that's really exciting, had recently come live with their first measurement. It was Ortho Virginia, a large group of orthopedics practices. By the way, orthopedics tends to be the lowest satisfaction specialty that we measure in the collaborative. And Ortho Virginia, H.C. Estenroder is their CMIO, and is really a fantastic leader, in my opinion, as I watched them, and they took their feedback, and they went from lower satisfaction, they jumped their satisfaction up from being one of the lowest satisfied Epic organizations to one of the very highest satisfied Epic organizations in their second survey. And as we talk to them about what they've done, we're still learning from them, but they've done a lot of training, a lot of working one-on-one with individuals to get there. They also use scribes, and but they were using scribes before, and they're using scribes now. But they have found ways to use their scribes not as band-aids, but as accelerators. So an interesting organization that shouldn't be successful because it's a bunch of orthopedic surgeons who typically are pretty unhappy. And now they're one of the most successful organizations that we've measured. And what do they do? It was a lot of teamwork, a lot of effort, and some really great leadership. So a couple organizations that we think identify and really show what this looks like.